This is you. This is me. I take a lot of space up here.
Time is now 7 o'clock. Everybody is ready, so I'm going to call to order the November 2nd, 2016 meeting of the Tilton Budget Committee. First order of business is to review the minutes. There are two sets of minutes. So,
Oh, the second set's in this
the
pile?
second set is here also.
Okay.
What we will do is we will review them and accept them, and then afterwards we need to turn in the non-public minutes
Okay.
back to Johanna. Okay? And those will be sealed.
Okay.
All right, everybody had a chance to review these? Anybody want to make a motion?
I'll make a motion to accept the minutes of October 26th as written.
Second.
All in favor?
Aye.
Aye.
Opposed? Okay, and I think we'll need a second one to accept the non-public minutes.
Motion to accept the non-public meeting minutes of October 26, 2016, as is.
Second.
All in favor?
Aye.
Opposed? I'm going to pass the non-public one to the meeting.
More material.
Makes me urgent.
Is that everything? All the extra packets?
Lakes Region Planning Commission. Look at that.
I guess our first person is not here yet. Lake Region Planning Commission. While we're waiting for them to come, they're not supposed to be here till 7:15, so we have a few minutes. Johanna brought up that she found out why we had not heard from Family Services, and it's because they had a new director come on board, and it was not a good fit, so she's no longer there. The old director was asked to come back to help in the interim, and during that period of time, for whatever reason, I guess our paperwork and our requests got lost in the shuffle, so no one ever responded. However, they're now in touch with Johanna, and they would like to come in So I think that they've done really good work in the past, and I think there's an unfortunate circumstance, and although the deadline is passed, it's my opinion that we should allow them to come, but I'm willing to listen to other people and...
I agree.
I don't have an opinion, really.
Yeah, I think we've been helping them out, working with them for
many years.
20 years or so,
And-
whatever
and
it's
they
been.
do a really
It's not
good
like a
job.
new request.
Yeah.
I'm not familiar, I think I
Is that
can,
okay with you?
Yep, absolutely.
Okay, then I think it's,
without pressing.
yeah. All right, the next meeting will, I think, should have time to go over the budget and look at that, and I guess there's gonna be a change in when the selectmen are gonna have their budget ready. Do you know yet, Pat, when that will be?
We will not, we have a preliminary one, but we've not been able to, we've had some other issues come up that took priority. We probably will not be ready to present it to you, even in the draft form, until December 14th.
So noted. All right. Is everybody aware of Lakes Region Planning? I forget that we do have, Matthew is new this year, and he didn't have any understanding of it, and I reviewed with him exactly what they are. One of the things that came up in our discussion was, Selectman Constantino made the comment she didn't know why we required them to come. And I'm not really sure why we do either, because we do contract services with them, and, we pay them for the contracts we do. We've never questioned giving them what they've requested. They're a vital organization, I think, to the town. Just like to entertain discussion. Does anybody else have any feelings or comments?
I was wondering the same thing, why, I don't think I've only been here a couple of years, but we've never had any kind of issue, so I think it's pretty straightforward. I don't think, we could certainly have the paperwork available, so if we want to research what it is exactly we're paying for, I can understand that, but to have them visit,
I use their website a lot.
yeah,
so-
or use their website, or just ask people how we've used their services in the
And
town.
we've used them on the planning board different times.
Right.
They're definitely a vital organization, I think, to the town.
Well, we used them last year extensively for a study that we did up on Silver Lake Road intersection, working with the state on the demographics.
Where's mine?
The, speed and, where there's a lot of accidents. And we were pushed forward on the 10-year plan to get that intersection fixed because of their help with the way things are. All that information comes from there.
That's good.
John, do you have anything?
No, they're great for helping to, tie some of the communities together
Yeah.
and work together on projects and all of that stuff, as well as some of the things that are important to the different communities, whether it be tourism, transportation, future, like highway changes and stuff like that. They spend a lot of time doing research for us to see trends.
As I say, anytime I need information on the town, I go to their website and it's just
Yeah.
It's used by many departments in the town.
Yeah.
Anyway, so.
Do they always just ask for the same amount?
No,
Or just
depends
based on what
they
we-
do.
Okay.
And one of the things, we had an occasion to use them on when we were talking about having a capital investment program in the town of Tilton. We, on the planning board, asked them to come in and do research because we had selected at that time the police department and also a project on roads. Like if we had a new development, we would use them, we would get money from the developer of the organization. And they helped us work on that. And midstream on working on that, some laws changed in Concord, which really made it to the point that we wouldn't be able to use them. We wouldn't be able to collect any monies at all. So they came back, instead of continuing to take money for us, they came back and said, it's really a moot point even go any further on this. And we really would feel guilty taking any more money, so we think the project should end, which it did. And I appreciated the fact that they did come to us and say that, they wouldn't be helping us anymore because things had changed at the State House. And we knew that RSAs that made it unnecessary for us to do it from a town perspective. So, I think, are you with the VNA?
No, I'm with the library and I'm very, very early.
Okay. That's why I thought maybe you were VNA, so. I know there's a new director.
No, sorry.
of VNA, and I don't know her, I've never met her. Have you met her? We still have a few more minutes.
So we're not doing a capital reserve with them anymore, or
No, it's
you
not
want to
capital
do?
reserve, it's the CIP. We don't have one. We've never had, I guess years ago they had it, but we haven't had it recently because we can't use the things that the police need are purchasing things, and you can't use it to purchase communication systems. That was one of the things that we wanted to do. And we can't use it to do that. It has to be some long-range plan. So we haven't had one.
Question, I don't know if we have time, but just a question of, has the budget committee, to your knowledge, ever said anything to department heads in general or the select board requesting like level funding for the year? Such a thing?
Yeah, we've, well, 8 years ago, we had no wage increases. I don't know if we've ever said level funding. I know we've been,
We requested department heads to come in level funding for probably about 2 or 3 years in a row. With us, and do it every year. Police was the only one that didn't, highway did.
except for the wages, wages are one of the things, and health insurance is one of the
Except for
things
that,
that,
yeah.
Then they have
But
to tie
other-
it to-
But other than that, so level fund everything except for wages and
Health insurance?
health insurance and all that. But then they stopped requesting that, or?
No, we still do.
Oh, you still do? Oh,
Every
okay.
year we request that.
Oh, you do? Oh,
Yeah,
okay.
every year we try to request that, but
Ah.
there are some circumstances that kind of go beyond that we need to get in there.
But we, as the budget committee, haven't done that. At least, we didn't do that last year.
Now, as one of the new people on the committee, do we see an itemized budget for each department?
Yes.
We do,
Yeah,
okay.
yeah.
Near the end of the month that we get, it's pretty close to that.
Okay.
one of the things about level funding is if, let's say, one of the departments plan to go and, in their budget, put a heating system in or buy, let's say, the town, the public works, and they wanted to buy a new compressor and paint this or that one year, and then the next year, they're not doing it, you may not want to have level funding. So zero
Yeah.
budgeting is actually, in my opinion, a much better way to go, and to look at each line and find out, what makes up each line, and make sure that, that they're spending in a way that's, good for the town.
Each line.
Yeah.
I was just thinking of more along the lines of sort of a goal, sort of a general goal
Yeah.
that we could have for them, since taxes have gone up every year for many years, so.
Most of the time, our taxes
Our
don't
tax
go up
rate.
because of the town. Our taxes go up because of the school
I know.
and the fire.
Speaking of that, you're on the school board budget committee, right? Could you announce and give us some, like, dates that we should,
We haven't started meeting yet.
oh, you haven't?
No.
Soon,
No,
though.
we don't, the school and the fire don't meet all year. We only meet just before the budget, when the information comes in.
Oh, okay, that's unusual, I think. For towns.
That's not that I know of. It's a district.
The school
Right.
budget committee just started, what, 2 years ago? Three?
3.
Okay, well, any important dates would be helpful, like, so the public can attend, and, like you said, that the school budget is,
Well, it's in the paper.
It's
when we
usually-
have our public hearing.
I know, it is in the paper.
And it's
yeah.
also usually down on the bulletin board here, isn't it? Yeah, it is.
Yeah. It's not on any websites, though, I don't think.
It's on the school.
Oh, it's on the school, somewhere on the school website. It's difficult to
Keep checking.
find it. Yeah,
You're gonna have to keep,
it's not on the first page.
The
It's,
fire's always on the website. The fire's
yeah,
on the website.
right,
And you can get to that website by going into the town website and
then going to it,
show
right.
it there.
Okay, all right.
But the public hearings are usually announced.
But outside agencies last year, we spent $177,000.
And that's another thing that we could possibly do is, do you want to level fund how much we give, as far as the gross amount for all agencies? And say we're not going to go above that, or do we not want to do that at all? It's just an option.
I don't think that's fair to the agencies. There's some agencies that don't even show up, that we've traditionally funded. I think that it's important to do it on a case-by-case basis. It's my opinion. How do the other people feel?
I agree with case by case.
Well, you could still do case by case, but you can say, we're not going to go over 177,000 and adjust accordingly. So our gross
Well, I
amount
think
that
for
we
the most
give.
part, that's what we do.
Well, we don't set that as a goal, though. I'm just saying, maybe people don't agree with that, but that is one way of doing it, saying, we give so much, taxes are going to go up, our tax rate is going to go up overall. So how much do we want to cap it at that as a total amount, and then adjust each on a case-by-case basis? That's certainly an option.
so here's the cookie jar, how we're gonna divide it.
Well, then we'll go case by case, but we'll say, we're not gonna go over 177,000 because our tax rate, because of the fire station and et cetera. All the other expenses that we have.
So next year with the fire station is the planning of it, but they're going to try and have something ready for the fire district meeting for approval this year?
I would say no, I would not.
They're still meeting.
I'd be surprised if they can pull it off by March, or, but
They don't have any place to put it, number one.
Their goal is to pull it off with them, but I don't know.
we tried a police and multi-thing for, 3 years? Still couldn't pull it.
Right.
We'll try 8.
Was it, yeah.
Oh, yeah. That's phenomenal.
So that's probably not gonna happen.
Probably, if you really add up everything, we probably spent close to 300,000 on architectural drawings, engineers, and, some type of
Speculating on property and
support
Wow.
to, for,
and then even the
We have
business
plans.
drive.
we have plans in the drawer over there for police and fire, both. They have no desire to do.
Yeah, that's gonna be a big one.
And we have 2 towns involved in that, and one is, from the meeting, is definitely not gonna go along with most anything, I don't think. I don't have a clue as to when that's gonna come to fruition.
But you have to figure that we pay 66%
Yeah,
of the budget.
yeah.
Our portion is 66%.
Yeah. There may be some jockeying too, because I think regionalization's the way to go. But that's the fire district, it's not really in our purview, so. Well, I guess it's 20, almost 25 after. If you would like to go on and go, we would be more than happy to hear you. You want to come on up?
I can. Kathy Mitchell, who's the president of our board of trustees.
That's correct.
You me here, though. I have to say, she's a much better public speaker than I am.
We love to hear from Kathy, too.
She would probably have some better gems to share. So if I could wait until she gets here, that would be like, I don't want to hold you all up, though. I'm the only
Well, I don't see that anybody else has come, so that's why I was asking if you wanted to come on up.
Okay, so if I go now, you all get to go home earlier?
Yes.
Kathy, what time are you scheduled for?
They weren't scheduled till
Okay.
quarter late.
Well, my name is Jennifer Davis. I'm from the library.
You want to have a
Hall Memorial Library.
Yeah, Pope Chair.
Usually people sit down.
Sure.
It's okay.
Join us.
It's a little friendlier that way.
Introduce ourselves.
Okay.
Should
Should I do my handouts first, or?
Yes.
Okay. In that case, I do have 2 handouts. And if you wouldn't mind, I'll just take 2 and
You want us to pass them out for you?
yes, that would be a delight. So these are just some bookmarks about an upcoming program that we have that the town hall is actually participating in also, so it's not necessarily part of the handout. So handouts are mine.
We were in Polly's this morning when it came around there, so.
Oh, good. It's picture book month. So we're doing a story walk, and I can talk a little more about that later.
Okay, we'll introduce ourselves. I'm Jane Alden, I'm the chair. Christine, you want?
Christine Dembitsky, how are you?
Very good, thank you.
Julia Harvey.
And I'm John Scanlon. I've been around.
Lovely. May I ask, under reason for attendance, should I? Funding?
Yeah.
Okay.
Oh, on the log.
Your needs summons. So yeah, I will, so that's the bookmark that goes with the story walk. It has started November 1st. It's, something that our children's, I'm sorry, I was looking at the word dinosaur. Our children's librarian is doing to promote literacy for Picture Book Month. The kids pick up a bookmark at either, I'm hoping the town hall will carry them. I dropped some off today for Joyce, just now actually, or at the Blooming Iris or with us. And then they follow the story, and they can go with their parents and read the picture book. And the idea was kind of a pre-holiday season sort of way to get people to enjoy November and be out and about. So we are hoping that the kids at the elementary school, both the elementary schools in town will receive the bookmarks. We're still waiting for word from the superintendent, but I brought those so that you could just have an idea of what that is. And then I wanted you all to know that, because I don't think we're always super clear on who our board of trustees is, so on the handout that I gave to you, it has the listing of who our trustees are. Right now, it's two people from Tilton and 2 people from Northfield. I'm not sure if any of you are familiar with Nell Grant, who is from Tilton. She has put her house up for sale, and she had been on our board of trustees for a very, very long time, but she is moving. So we do have an opening. And we're hoping to have that filled possibly by Morris Boudreau. I'm not sure if any of you know him. He's from Northfield. He worked at Lowe's. He had been a handyman at the library. He's a very dedicated patron too. So we try to get patrons. And you all appointed, well, no, I'm sorry, the selectmen appointed Jeanette when our last, when we had some changeover the last time. So she should be hopefully running again for the town of Tilton in March. And one of our big questions is always how many people have cards at the library from Tilton and how many from Northfield. Right now, it's 1782 from Tilton and 2411 from Northfield. Those are our card holders whose cards have not expired. So every 3 years, our cards expire, so we can update our information. We'll update their information so we have accurate mailing and contact information. So then I included some statistics. These can all be found publicly. They're the statistics that we have to give to the State Library of New Hampshire, so they collect these stats from all of the libraries. And I know it doesn't give you any reference per se to some of the previous years, but these are our numbers for 2015. I will tell you that as of September, we're already 1,000 computer sessions more than we had been last year, which is really, really significant for us. We put in a new computer system by a company called Userful. So we have 5 public access computers and 2 catalog computers. And it's a Linux-based system. So it works a little differently, but we only have 1 computer that runs the 7 hubs, and so we're hoping it'll have a little bit of help with the electricity, but it works so much better than it had before than having 5 individual computers. So that has been very popular. Knock wood, we haven't had very many outages thus far. That went in January. So we do have 2 full-time staff members and 6 part-time staff members, plus a part-time handyman or cleaner. But I put in a caveat there. 4 of our part-time staff members work 12 or less hours, including one of our previous pages who went to college, so he averages only 2 hours a week. So he comes and works every other Saturday for us, and he's just really fantastic. So it helps with filling in some of the places where the rest of us can't. And let's see, I have a few other items on here that I would mention. We are planning to offer an e-card. We purchase services through New Hampshire Downloadables. It's a consortium of a lot of the libraries in the state, most of them, for ebooks and digital audiobooks. And we know that there are a lot of taxpayers out there who can't necessarily get to the library to sign up for cards. So we have started writing the procedure for taxpayers to contact us, and we will confirm who they are against the tax rolls in Tilton and in Northfield, and we'll give them a card that will enable them to check out all of our electronic resources. And we're hoping to reach more people that way, especially a lot of our commuters and people who don't have a way to get to the library in a more traditional way. I did want to mention that we through the town of Northfield, we're partnering with the schools so that our electrical supplier rate will go down. Hi, Miss Kathy.
We started early.
We started early.
Because we didn't have someone.
I was feeling left out.
She wanted to
We wanted
wait.
to make a grand entrance, Kathy.
Welcome, everyone. This is Kathy Mitchell, our fearless
Yeah.
president
Hi, Kathy.
and leader. So I'm rambling off some lovely numbers, but this is our handout that I gave everyone to start with. So I believe we had been paying, and Kathy doesn't know this yet, but we had been paying 15-something cents per kilowatt hour and for the electrical supply, and we're now paying 6.8 cents.
Whoa.
So
Wow.
it's gone down a lot. I'm very excited. And I know that will not be, there'll be additional fees for the, to Eversource, because they're 2 separate companies, but we're hoping to see some savings there. And we also partner with the schools for a lower oil rate. Let's see, so then I just have, I guess, 2 other points. 2 years ago, we had some ice dam damage, and it took me a long time to find a contractor, but we finally did, and we had most of the library around the main circulation area repainted, some of the walls fixed, and all of the children's area flooring replaced. So it looks really great. That was our big capital improvement for the year. And then we also this summer added a memorial garden to the front of the library, including a bench and a fenced area in honor of Kelly Finnemore, and we hope to dedicate that in the spring. I included a calendar of events for the month of November. It's the pink flyer, so you can see some of the things that we're doing. We have 3 active book groups. I don't know if any of you play chess, but Monday nights we have people who come all the way from Concord and Manchester every week to play chess. They're diehards. Every other week on Mondays we have a Scrabble book group, and they're very competitive. We have drop-in math tutoring, knitters and Legos, and also this year our children's librarian has started a STEAM club. You probably already know this, but it stands for Science, Technology, Engineering, Art, and Math, and so they meet once a week for 6 weeks. And when that is complete, last year Julie, who's our children's librarian, received a grant to do a program called Bedtime Math Crazy Eights. It's a math club where they do all of these super fun math-related activities, and that's also a 6-week program that has been very popular. So that started last year, and we will continue it after STEAM is done. So those are some of the highlights. And if you have any questions, I have some answers I can try to fumble through.
I have a couple questions.
Yes.
What do you think the difference in the number of people with the cards, why Northfield is higher than, why do you think that?
I do not know. It is something that we talk about
Do you think it's
often,
more
though.
condensed, populated, or?
I think in many ways it's because Northfield doesn't necessarily have like the post office isn't in Northfield, and they don't have like a main congregating point.
Oh, okay, yeah.
And so we
Yeah,
have
that
heard
makes
it.
sense.
It has been suggested by some of our patrons that it's a great place to come together
Yeah.
for community. But I don't have a solid answer for that.
Do you think it has anything to do with the fact that you're located in Northfield?
Right near the school and,
It could. I mean, it really certainly could. I feel like we're so close.
Population?
Yeah, what's the population?
School population is higher for Northfield, too.
Is it?
Yeah.
I feel like we are going to do some outreach this year for, like I said, we are going to start with this e-program for all the taxpayers, and we're hopefully going to do a mailing around that to everyone, and then we're going to look into an additional mailing to people who live within our zip code and get our name out there more. You might have borrowed that back for a minute. I think you went from this.
I know you have programs in the evening. I've been to several of those, and I'm trying to remember how I found out about them.
yeah, do you have a
Well,
website?
online.
We do. We have
Seen the paper a lot.
a
I think
website.
the paper's where I saw it.
Yeah, and we have a blog, and we're on Facebook, and those get a little, I feel like those are kind of fading in popularity. But we have a pretty good column every week in the Echo and in the Daily Sun, and we had one in the Citizen. And then we also have a monthly roundup that goes into those two also. And we let the radio station know when we're having big events. So it's kind of hit or miss. We also have our sign. I don't really know how many people from Tilton per se see that because they don't necessarily get to drive by it. I will say, if you look on this handout, it says that we have 4,500 card-holding patrons. And if you do the math, the members from Tilton and the members from Northfield, that doesn't necessarily add up. But we do have non-resident, I think, patrons who pay $30 a year to use our services, and they come from Canterbury. We have a lot of people from Franklin a few people from Hill, and we even have somebody from Berlin. So we do have people from other places come. And there's two former librarians, they're actually currently looking for work, who come and use the library quite often now. They're from Hill, who seem to really enjoy it too. And a plug for the trail, we get a lot of people who come in and use our bathroom who've been walking the trail. And I know that sounds sort of strange that I should say this, but, we get to chatting sometimes, and we've had people from a lot of people come from the southern part of the state for the day to walk and ride the trail. But we've had people from as far away as New Zealand. And one family came from the UK this summer, too. They said they came over. So I just thought I'd throw it in there before I forgot.
That's great.
What do you have any programs, what kind of programs do you have that you do in conjunction with the schools around? You're so close to one of them.
We do, to Union Sanborn. Well, our children's librarian, Julie, goes in and does book talks.
Okay.
She works quite often with Judy Brady, who teaches 4th grade, to go in and talk about like some of our newest offerings and some of the things that are more popular. We also try to do as many of their community nights as possible. I'm trying to remember, I guess, open house night and parent-teacher conference evening, although both of the schools had it on the same time this year. And Anna Benavides is the Union Sanborn librarian, and we try to work with her to do some programming too, or to come over and do some reading. They've started a secret reader program this year, so we're participating in that, where the kids get clues and they try to guess who's going to come to their class and read to them, like throughout the week, and then somebody comes and reads to them on a specific day. So we're doing that. And I feel like there was one other thing that we did with them too. But I can't remember it right now.
Do you do any programs with the Pines?
We have not done any programs with the Pines in a really long time.
Any other questions? Kathy, do you have anything to add?
Library, so I'm not sure.
Well, I'm a big fan of library. I'm a big fan of libraries in general, and
Every month that we get more people who are signing up to be patrons. I mean, it's a huge, I think 39 people last month is a huge number.
Over the 12 months of the 2015 year, we averaged 33.75 people each month signing up for new cards. So a new card would be anybody who has moved to town, of course, and never had a card, or anybody who's had a card that has that had expired 6 years previous. So that's considered new.
And then the programming, you disclose my mind. Look at the list of things each month, and I don't know how you do it. And then I walked in last week, and then the sewing machines all over the place, and people are sewing. And this is wonderful.
We have a very active
Yes.
sewing quilting group on Tuesday mornings.
And the knitters.
Some Tuesdays are really busy. It's either the third or the fourth Tuesday because we have Spanish club, sewing club, and then we have the Nooners book club, and they are die-hard book club people. They're always there for at least 2 hours, and they're a lot of fun to listen to. So I think they quite enjoy it.
So you have the little kid carrying on the book and the older folks and everybody in between. It makes me so happy every time I go in. So as I said, I'm prejudiced.
Transportation to the library, do you have any arrangements for that, for the Winnie bus service, or have you partnered with them?
We haven't partnered with them, but I do know a lot of people who have used them. And a lot of the folks who have used it come in talking about it. And we do give out their information. They have a spot on our bulletin board, and we have some flyers in the library also.
So people that have hard times to get there, maybe don't have transportation, there can be some type of arrangement made for the bus.
We have quite a few older patrons who, I don't know exactly which apartment building they live in, but it's an over 55 apartment building. And they'll often carpool with there's two people that have cars that will offer to give rides. And when they can't do that, they use the transportation system. And though it's not official, we will sometimes drop things off to them on the way home. Like, I head out to Hill, and we have a couple of people who go in those directions, so we try to help
It's
out.
homebound or...
Yes, and we do have a homebound program. We do not currently have anybody in it, but we do have a volunteer who is willing to go out and meet with people and deliver books. It is unfortunately, it's a volunteer position, so it's only once a month. But right now, we don't have anybody in that program, so if you know of anybody who would like homebound services, we do have that. We advertise that through, it's been in the paper several times with our happenings, our monthly happenings, but also through the senior center. I try to talk to Cindy fairly often so that, we can stay on top of who might need that service.
Okay.
And 2 years ago, when there was a snow day, put up on a Facebook page some links to things to go to read or to do stuff, which I thought was fantastic. I'd love to see more of that. And I
Excellent.
wasn't going out.
It was probably our overdrive system for ebooks.
Well, I'm sitting here and thinking, and I used to live in Atkinson, and the library was 3 times further away than this library is, and I was there all the time. Because I traveled back and forth to Boston, I used the CDs, I actually went there and got CDs to watch at home, and yet I never go across the river to the one here unless I hear about a special program, and I'm trying to think of why that's the case, when I used to have to go 3 times as far to get to the other one. And I don't know what that is, but that's probably why the incidence in Tilton is as low as it is.
It would be nice if we were on, like, the main drag.
Yeah.
And I think last year you had asked if we ever thought of moving, and unfortunately, fortunately, the land and the building were donated, and if we were ever to move, we couldn't necessarily sell it. It would have to be deeded back to the original donator's descendants. But I feel like we're doing really good things. Anecdotally, we feel much, much more busy now than we have, say, 2 years ago. I wouldn't necessarily say that revolves around our books. If you were to come into our library on, Tuesday or Wednesday, any day, really, the only day that we're super quiet is Friday mornings. We're very quiet, which we get a lot of work done then. But if you were to come in and feel the amount of people that come in, it's a much bigger number. And we do take accounting twice a year, in October and then again in March, the same weeks each year, so that we can extrapolate out that information, but it feels like we're much busier. There are a lot of people who come in with their direct service providers for tutoring and just to read. It seems like there's a few social groups that meet with their direct service providers, so we do end up providing that essential service too.
I work in a library, and it's true, there's so many people that just hang out there, or they're there every single day. And it's not about necessarily your books or media, it's a busy place. It's great. I wouldn't want you to move. I love the library where it is. I love the building. It's a treat to go into it. And there are a lot of great programs. I haven't been much because I work so much, but...
Well, I feel like when you work, I don't go to my library in Hill, so I mean, it's hard when you work there. It's not like you're...
I have a younger friend who was telling me that she tries to spend one day a week with her kids. She has 3 kids, and they're all different ages. And they all go to the library one day of the week. And the little boy plays chess, I think, and one of them gets on the computer and does something on the computer. She uses the time to read newspapers that she wouldn't get to read, like the New York Times and things like that. So she makes a point of doing that. If we could get more parents to do that sort of thing.
Yeah.
I know growing up, I spent all my time in the library, and I used to go there and study after school
That's
because it was a quiet place. But I think the size may restrict the one here.
It would be nice to have more room, of course, and a meeting room. We do lament that we don't have a meeting room that we could rent out to people to use, or a place for a maker space. That's very big right now in the library world, turning libraries into places that can be a space where people learn more things. So we're trying to kind of figure out a way to utilize our space better. I'm not sure how we'll be able to change it, but we do love our regulars who come in, especially our families. And it seems like it's, I don't know, that's like the best part, seeing the families come in over and over. We just had a new baby born. We didn't, but you know, like it feels like it because they come to story time every week with their older daughter, you know, so it's kind of that kind of feeling.
One quick question. I think it was last year, or maybe the year before, I don't know. The gentleman who came in that represented you was talking about your software programs on your computer and a little bit of difficulty with, if I'm remembering this right, with whoever does the tech support for the computers. I was just wondering how that worked out. Who handles tech problems? Is it, because that was a problem, it's a problem with where the library is, where I am. Server problems, do you contract out some of that, or?
That is one of our most difficult areas, I would say. And so that is why that was part of the impetus behind getting rid of the 5, or it was actually 7, like, full-time, full computers, because the other full-time person who works for me, Brittany Moore, she's young and she's a Spitfire, but she's also our young adult librarian. She's our cataloger. She does all of our cataloging, and she works the circulation desk, and then she does all of, she does a lot of everything. So by purchasing into the user-full system and just having that one server computer with the 7 hubs, plus then we have 3 staff computers, that has made it so instead of spending like 4 to 8 hours a week on IT stuff, she's probably spending 1 hour a month on it. It has made a significant impact, and it cost a lot of money, but
initially,
it has
for the system
made such a difference in the end. When we do have problems, there is somebody local on 140. I cannot remember the name of the company.
Mainstays.
That could be it.
Mainstay?
But I have a card, I have a Rolodex, because I'm old school, can I say? But we will have them come out and they can usually fix it. It's almost always, it's been a printer problem. The rest of the things we can kind of fumble through or work things out.
Do you pay, sorry, I haven't had a chance to look at that.
There's a
How much do
technology
you
fee.
You pay them like a contract fee for the year?
We don't, we just pay them to come in as needed.
So it's probably
Yeah.
not Mainstay then, because I think
They
they,
have-
106, I was thinking.
Oh, 106.
yeah, don't go with them. no.
I'm sorry, I can't remember. Our technology
They're very
fee covers all of the things associated with the computer, but also our ILS. So that's our catalog and how we check things out and keep track of
Yeah.
everything. So that's the main part of that.
Well, that's pretty good, actually.
Yeah.
Sounds like
And
you found a
I
good solution.
feel like we made some really good headway with that.
Yeah, that's great. Thank you.
Nice.
Any other questions?
The numbers. We have to go over the numbers. We're here for budget. I'm looking, I see one thing that's good. It seems like the furnace is it's doing pretty good. Because that's been finicky on and
If you
off.
have jinxed me,
I'm seeing you do it,
knock wood, it seems to be okay. So it has a crack in it that we had sealed, and so it passed its state inspection, so we're good with that. We have tossed out possibly switching over to gas, but the proposals we received range between $3,000 and $36,000, and so it's been a very, they were like, well, you could do this, but then you could also do this, and maybe throw in this wire, so there was some confusion there, but so far, we've been fairly lucky. I will say that they did have to come back right when we turned it on this time. We have some circulator issues, so they'll be back again before the end of the year, but hoping that we can kind of limp along until January, until the new fiscal year. And I will say, we are going to be over in programming this year.
Which is a good thing.
I think it is, because we do all of those programs on just $1,000. And there's another place we're gonna be over, I think we already are, well, that's in electricity.
What do you do for grants in terms of your programs? Do you use grants a lot for those?
We don't use them a lot. So far we have had 2. They're both for the children's programming. We have a kids, books, and the art grant. A kids, books, and the arts grant. It was for 3/4 of one of our summer programs to bring a performer in. We have received that 3 years in a row. We usually take a year off every now and then from asking for it. And so we received that this year. I think it was for $225. And then we also have the grant from the math company, Bedtime Math Crazy AIDS Club. So what they do is send you 2 giant boxes full of supplies and all of the programs that come out of it. So you don't have to pay for it. So it's an additional program. But those are the 2 that we have secured thus far.
Okay, so we go, ground maintenance is up.
Our grounds maintenance, the money that was budgeted, the for 2016, it was budgeted to be $1,500. That is intended to be for plowing, but we did have some other grounds. We put in the garden. That has been we had received donations when Kelly had passed away, but that was from 2 years ago, so it was kind of in a different pot of money, but this is now, not a different pot of money, but, so that was the money from that year, and anyway, it came out of here, and so that's why we're over.
So in next year, it's going up?
Yes.
250. Why is it? I was just curious, is something new?
We are hoping to engage a landscape company to actually continue the work that we've started. We do have 3 trees that need to be trimmed and 1 tree that actually needs to be taken down. And then we want somebody who can, not advise us, but who can treat our lawn so that we have lawn.
Do you put that out to bid?
No, I don't, like, you mean like placing an ad and having people bid on it?
Yeah, a request for a proposal and then get a bid from the different landscapers that are around?
I have just called around and asked people to give us quotes. So I guess, yes. I mean, I didn't put an ad in the paper, but I guess that technically isn't a bid. But we have asked for different quotes from people.
So you get various quotes and pick from one
and
of them?
then pick the one that we feel is best.
And is that both you try to get the same people to do your maintenance and your plowing? Or?
The company that plows for us is engaged through the school, and so they pay, well, I guess we're billed separately, but it's a contract through the school. So I believe I've called the company. I haven't heard back. This is just an estimate, so I haven't heard back from anybody yet. It's something that we started in September.
The front of the building is looking a little sad this summer, and just thinking about maybe not spending a lot of money, but doing something to build up the lawn, which was more crabgrass than anything else.
And up to this point, most of our gardening has been done by our janitor/handyman, who is only with us 10 hours a week. So gardening has not been something that he focuses on. It's really hard to keep up with just the cleaning part. So he mows for us, weed whacks.
The capital improvements you talked about earlier, where are they listed on here?
Those were paid for by our insurance company, so they are not on here. It was just under $10,000. We also had a stained glass incident where we had to, something broke a part of our stained glass windows and we had to have that replaced. That was also covered by insurance.
We go down payroll. It's up
Payroll.
up by 4650, the request.
The trustees decided to budget for a 3% increase in case they wanted to give pay raises it's usually in March after the town meeting has occurred. Knowing that if you don't budget for it, it can't occur.
It's not adding anybody on or to
It is not,
payroll or
no.
not a full-time. Yeah, because the insurance would go up too if you fill not
Yes.
full-time. So
Well, they got
the
6 part-time
taxes.
people.
We do, we have a lot of part-time people. We did ask for an extra $100 this year towards programming. And we did request less for our telephone and less for the electricity because we are hoping to see some savings. And that was before I found out about the reduction in the kilowatt hours, so hopefully there may be a little bit more there too.
Is there anything for like solar energy or, I always hear about the great programs they have for that. Or other ways to, I guess, what's your major light? Is it lighting or electrical? Is lighting or heat, running heat?
It's lighting. Our heat and our hot water is all run off the furnace.
Yeah.
Except in the summer,
Except that
we don't have
all
hot water.
uses motors and.
Yeah,
and so-
yeah. So in the summer, we only have hot water to one sink. It's a tiny, little hot water heater that we have under our sink downstairs.
Yeah, just enough
So that
for
we don't
that.
use the furnace.
I wonder if there's anything available for solar grants or something like that.
I could certainly look into that.
Be nice to
I
get
would
free
think because
solar,
we're-
'cause, which would give you free lighting, go to LEDs or
That's
things
$3.
like that.
It's gonna cost down south of schools.
I don't know how that would work with
Yeah,
slave
they're quite
work.
expensive.
It would probably have to be somewhere else
you
on
still
it.
have-
They
You know-
can still mount it on a slate roof. And the thing is that they rent the solar collectors to you, and there are different companies around that rent those collectors.
I know for your home, you can lease them or purchase them outright. Just based
And
on.
it's the same way for companies or
That's it.
schools or whatever.
I
We're
can
getting
certainly
ready
look
to
into
do it
that.
out at Southwick School.
Oh, really?
Yeah.
I think it would be great. I think it would be a really great way to show a lot of our kids, how we're
Interesting,
interested in
Yeah.
renewable energy and some of the math and stuff behind it.
and plus they also have lawn-type ones.
Yeah,
It's,
you don't have to worry
You
about that.
wouldn't have to
part of it.
worry
you
about
don't
the
have to worry
lawn.
about that part, but, maybe you could put it up a little higher and hang grapes under it or something.
They
But
don't have a big enough lawn, I don't think. They
No, it's
could-
very
maybe on the
tiny.
side facing the
They're
train
huge.
station.
We-
I'm
it-
not sure which way the sun goes.
Yeah, it doesn't get
but-
much use, except by the neighbors' dogs.
But it might be worth your while to contact one of those companies.
Do you know who they're using or who at the school I would contact?
They got a grant to do it.
Ian
and
Raymond is the person to contact.
Ian Raymond at the
Yeah.
school.
I'm going with LED lighting, and I'm not sure what's up there now.
Oh, well, and that is the other thing. In 2014, no, 2015? Recently, we replaced all of we have schoolhouse lighting, it's called, and those were all transferred over to an LED lighting.
Nice.
And we used somebody left us money in their will. And so we used money to replace our lighting for that. We're having a few glitches with it now. The light bulbs seem to be burning out, but when they all work, so I'm working with the company Jaguar Electric to see if, what they're coming in and replacing them as they burn out, and they're not supposed to for years. So we're working with them in the manufacturing of the light bulbs, but when they work, the lighting has really changed in the older part of the library, and it's much more vibrant and fantastic.
Cheaper, too.
Yes, that was our hope.
Doesn't take too much solar energy to run all LED lights. You can,
I will definitely look into
maybe
that.
attract
We should
people.
probably move on.
That's what I was gonna say. Anything else?
Yes, that's it for the money. These year-to-date that I'm looking at, you know, okay, September
I
16th.
was gonna say, that was as of September 16th.
Okay.
And I can submit our numbers at the end of the fiscal year, that, not sure when you meet again in the new year, or when you make your final decision.
Yeah, maybe towards the end of this month.
Yeah,
Be
I'd
nice to
say
get-
probably the end of November.
Okay.
And up to date, in case there's changes happen. That's
Okay,
great.
great, thank you.
Thank you.
It's not just a library anymore.
No, it really isn't. It's certainly changed.
It's great.
Thank you.
Thank you.
Thank you.
What library did you work at again? I know you told me last year, but I can't remember.
Oh, Plymouth.
Thank you.
Oh. So Diane's your new director?
Yes, yeah,
Excellent.
yeah, she's great.
All right, are you visiting nurses?
Okay, let's find that.
Sorry, you weren't here, and we wanted to make use of the time. It was like half hour. I'm Jane Alden, I'm the chair, and
Matthew Kroll.
John Scanlon.
he's our selectman.
Juliet Harvey.
Christine Dembitsky. Christine Dembitsky.
Nick Johnson, I'm the finance director. Finance
Okay.
manager.
This is,
For coming.
Considering a request and thank you for
I got this.
the generosity you've always shown.
You got it.
Well, thank you for the services you provide also.
they're barely in.
We're glad to do that, and we are continuing to provide services. We provide skilled services, which include the nursing and the therapies, as well as providing unskilled services with homemakers and private duty nurses' aides. We're kind of being crunched by Medicare, or CMS, I should say, which stands for the Centers for Medicare and Medicaid Services. They've been cutting our reimbursement for years. They're rebasing it. They feel that home health agencies have a large margin that they felt was unsustainable, which in some cases it was. I wish I could say that we were one of the agencies that had the margins that they were quoting of 14%, but I think last year our Medicare margin was perhaps under 5, it was 4.6, I believe. 65% of our clients are Medicare eligible, with 20% are Medicaid eligible, and the remaining percentage is commercial insurance. Medicare is the only insurer that would allow us to have any sort of positive margin when we do our services. So all of these other reimbursement sources don't even meet our costs for providing services. We do have grant funding for some of the homemaker services, and that's through the state and through Merrimack County as well. Even still, it still doesn't break even. We've experienced an operating loss for the last year in 2015. We had an operating loss, and so far this year, we have an operating loss. We're still holding out hope that things will improve, and there's been a lot of regulatory changes where we're required to provide documentation of clients' eligibility as well as a face-to-face encounter. It's a lot of detailed paperwork, and Medicare looks at these charts and they request all of our information on these patients. And, if all the i's aren't dotted and the t's crossed exactly, they can deny payment, which they do, and that's of course after the fact, after we've already provided the services. They can say something, well, the patient didn't have a skilled need, or the patient isn't homebound, or your documentation doesn't support that. So we've been working really closely with our clinical staff and with our quality utilization, our quality review and utilization review to really manage our clients. So we're paid by the episode by Medicare. So for the 60-day period of time, we have to provide all the services that they need for this X amount of money, this standardized rate that is based on our answers to assessment questions. So there's a lot of education with staff, as well as getting our clients to really have goals. It's no longer, it's not just a visit per se. You know, we have to go in and have goals and know what it is we want to accomplish in each visit in order to help keep people at home and out of the hospital, and to help them heal their wounds or improve their mobility, and to manage their chronic diseases. So we're struggling, and we're looking at new sources for, reimbursement, and I think we'll probably do some more searching for grants this year. And honestly, I hadn't done a lot of that. We did get 2 grants, the state and the county. We did get a grant from Franklin Savings Bank for a new program that we implemented this year, and that was a caregivers support group that is being co-facilitated with one of our social workers and Lakes Region General Health Care, their community education person, called Powerful Tools for Caregivers. So I think more and more of us are finding ourselves in the position of being caregivers for family members or our spouses even. So this program is providing a lot of resources and an opportunity for caregivers to have some place to talk with other people who are going through similar situations. So this year, we're asking Tilton for level funding. We did have a 13% increase in our visits to Tilton residents, and that includes skilled services as well as unskilled services.
How has the Affordable Care Act affected you?
So the Affordable Care Act has expanded, it's done a couple of things. It's expanded Medicaid. And so although that's great for the population who now has some sort of coverage, for us, Medicaid is probably our most challenging payer, because we get reimbursed about 50 cents on the dollar when you consider that it's now managed Medicaid. And so not only do we get a low reimbursement rate, we have to call for prior authorization. We have to submit all this documentation in order for them to say that, oh yes, we can do the visits, and so you do that now, and then, okay, you can have 2 visits and, call back.
Now, you have to do that for Medicare too, though, right?
No, for Medicare.
Not at all?
No, for Medicare right now is not requiring prior authorization, and I hope that they don't. It's a lot of paper. It takes our intake nurse who goes after these authorizations about half her time, she says, to track authorizations and to make sure, that we have the authorization, because they won't pay you. And when with these companies, WellSense and New Hampshire Healthy Families, who, administer these programs, you can't backtrack. So if we get information that someone had like straight Medicaid, and, straight Medicaid didn't require an authorization, so no one got an authorization. Okay, 20 visits later, you realize, oh my goodness, they're well sense, and you can't backtrack, and you've done those 20 visits.
You're not getting paid.
That's right, didn't that exactly happen today?
Yeah.
Where in Medicare, the CMS, with the Affordable Care Act, CMS cut payments by $260 million for 2016, $60 million for 2015, $200 million for 2014. So they're trying to recoup what they felt was overpayment to home health agencies over that period of time, and they're also rebasing, so they're cutting our reimbursement. And in 2017, we're expecting another 1% cut in Medicare reimbursement. So, I mean, I understand with budgets and things like that, and I'm getting a lesson, every day.
Now, you mentioned Merrimack County. Do you get reimbursements from Belknap County as well, since you service both counties?
No, we don't.
You don't?
We don't get anything from, but we, honestly, well, I shouldn't say that. We do get some from Belknap County because the homemaker, is the Belknap, no, that is all Merrimack?
I'd say that's all Merrimack.
That's all Merrimack, okay. So
Have you thought of going after Belknap County?
We haven't tried in the last year.
Yeah,
I don't know if we've tried in the past. I've been at the agency for a year, so I don't know if we tried before me, but I haven't tried yet, no. I don't think it's a bad idea.
Well, I'm just saying that because we're in, I know you do a lot of services in the Tilton area, and I would think it would be to your
yeah, we do Tilton and
advantage to do that.
Belmont
Yeah.
and Samberton.
I would think it would be.
Yeah, they should.
Now, you're saying you're going to service more people next year than you did this past year. What do you base that on?
What do we, how do we?
Well, it says you served 66 people this year from Tilton, and you're projecting you're going to be serving around 72. Is that just from growth, the growth pattern in the past?
I think it is based on, it's based on growth, it's based on, the demographics, how, we're
Aging.
aging.
Yeah.
And that's about the same increase we had from 15 to 16. We had the 13%, so I think 13% from 66 is about 72, so we're hoping it continues.
Are these your most recent financial reports? Because they're August of 15, unless the date's wrong.
Those,
August 15,
August 15th.
that's
this is
probably not.
December 15 and 14. This one says December 15 and 14.
The most recent budget we have is for 15. We don't have a budgeted figures for 2016 yet, but we have, I could provide you
Like a year-to-date or
year-to-date,
something like
yeah.
that.
I have through September done. I'm working on October now, so.
Is your year end 12/31?
Yeah, so
That would
I
be
can,
helpful.
we could definitely provide those.
Would you do that, please?
Yep.
So on this first page, the statistical report at the bottom, it says total visits 2014, but up here it's 15, 16, so that's just a typo, right?
That bottom 2014 is a typo, yeah.
Is that 15?
I noticed
Or end
that
of
today.
16?
Which, let me find that page.
And these say Tilton, so. This is,
It would be,
This one here.
yeah.
The total visits
So it's
is
Tilton, I
what
like
we
that.
had for these
It's from
two.
August
So it
15
would
through
be
July 16.
So down here should be
Yeah.
16.
Yeah, that-
Okay, perfect.
Yeah.
I saw that Wayne Brock's on the board of directors. Yeah. I miss
Yeah, is
Wayne.
he no longer part of,
Yeah, he's got too many things going on.
Had some health issues himself.
yeah. He hasn't
He's-
been
okay,
to
I
ours
see.
in several months.
Yeah.
Yeah,
Okay.
We haven't seen him in a little while.
So these ended August 15, so this should change to December 15, and then
If you add those two figures together, it gives you that.
this one?
Yeah. No, no, on this.
Oh, I'm on the next page.
You're on the next page.
This one here,
Oh, year-to-date budget? Oh,
yeah,
that, will
this
that
was
include
compared to.
16?
Well, I can give you what we have for 16. Yeah, I can do the same report for 2016
Yeah.
Okay.
through as of.
Yeah, it'd be
through
good,
September
12/31,
of- I can do it
15
through
to
September of
year-to-date.
16.
Okay.
And the budget, we don't have 2017 budget numbers yet, but I can definitely give you this through September of 16.
The last one was done. Could you add the, projected on, through 16 as far as you can on the statement of operations as well?
Yep, I can do that through September also. This, like this one,
That'd be the only one I would wanna, yeah.
yeah, I can do that for sure.
Revenue's definitely down 15 from 14. Did you say you projected a loss for 16 as well?
Yes, year-to-date operating loss through September is about 70,000 right now. I know that without having it in front of me.
3 more months. It'll be similar to 15 then.
Yeah, we're
Yeah.
hoping it comes up a little bit, but the last few
Get on
months.
those grants!
Yeah.
Get Belknap County.
For 2016, I don't know if that's gonna help us, but.
Well, I know that
That's
more
all
and
I
more
have.
people in the Tilton area are requesting your services as opposed to the
Over.
Laconia services, so.
Well, that's a good,
Mm-hmm.
that's good.
Well, it's a good thing, but it's also
Unless you have
more
to foot
reason
the
for
bill
you
of
to
it.
go to
Belknap.
Belknap County for assistance. Selectman Constantine.
I have a question on that same venue, because if your revenues are really, really low,
They have gone all the way up.
part of the issue, which I've experienced personally in the last couple of months, that when you go into surgery, had I not called prior to that to you folks for options, I had surgery in Concord, they automatically put me into Concord BNA, not Franklin BNA. And that was a real issue with me. I had to fight for them to give me Franklin BNA. So when I came out, after all said and done, there's probably a dozen people I've spoken to that same scenario has happened to them. So what can we do to prevent that or to help that? You know, it's sort of jurisdiction, actually. You service the Franklin area, which is Tilton. You know, I don't really want a nurse that I don't know come up from Concord and have to travel.
Yeah.
Be late half the time.
In the winter.
And the winter and everything else.
Well, I had trouble with the ones in Central and had to request Franklin, so,
Really?
yeah.
When you have to, I literally had to ask to speak to, what do you call them, a social worker, coordinator, dischargement, right, to say no. And the doctor came in, I had to have him say, no, I want Franklin DNA. Do not put me in Concord.
I also know examples of people who were in the Franklin Hospital, and rather than refer them to you, this was for hospice, they had people from Laconia come.
So how can we prevent that?
I'm not sure how we can prevent that, because, well, with Concord, what happens is that Concord DNA is part of the Capital Region Health Consortium, and so it is beneficial for Concord Hospital to make those referrals to Concord DNA because it's the success of their whole business.
although it is illegal for people not to be given a choice, and I know that it's been taken to court, and they were ruled against, this was years ago, I'll say now, they continue to refer to Concord DNA. They won't, because there's several reasons, I think. One is that they can control outcomes more. They're, with the coming online of accountable care organizations, where they're starting to reimburse, not in New Hampshire yet, but in 9 states there's a pilot going on with value-based purchasing. So you go into the hospital for a knee replacement, and Medicare is going to pay X amount of dollars, because this is a knee replacement, and this X amount of dollars is going to cover you from the surgery through 90 days out. And that, so whether it is a skilled rehab facility that you go to, or a home care agency, or no services whatsoever, that's how much money they're going to, CMS is going to pay. That's what, they're trying to save money. So they're thinking that when people join forces in partnership, there's one unit that's handling the money and doling it out, and they're deciding, what's going to work and how many visits you're going to do, and what are those outcomes going to be in each of the visits, for that joint replacement. So this is all in its infant stages, and it's going to, but this is the way that healthcare is moving.
I think we should have a choice, though. I mean, it's up to our. I didn't have a choice. I was worn out because I had information from you folks that they may switch me to Concord, and I made sure that didn't happen. But what about all the other people that you service that don't have that happen? I think it's shameful myself. I pick up the phone call and send it. I think it's really shameful because
I think
our residents in the town of Tilton should not have their choices be taken away. When you go to any hospital, be Laconia, or Concord, or Boston, they should have their choice of home health care.
I'd like to,
Yep, yeah.
Because we know that's happening.
Should be offered, they should offer.
We're trying to
Bill
make
of
sure
Rights.
that more people know we're an option. One thing we did this year, which we haven't done in the near past few years anyways, is we took out a radio ad this year to try to advertise, we are Franklin VNA, you can choose. We have 3 or 4 different advertisements, different dialogues that are advertised on the radio right now, and one of them is saying you can choose, like it says, choose Franklin VNA, to let people know that without saying like, don't go to Concord or don't go to Laconia, letting people know that they can choose, they have the option of choosing us, and we're trying to let people know that way without being defensive about it.
think about home care until they need it. And then when they're ill and they're in the hospital and they're steered one way or another, sometimes it's...
At your lowest point, and you need home health care, you're excited to get home health care. You're not asking those kinds of questions.
Or you might not even know that there is an option.
Yeah. That's,
You might want to contact Cindy Claren back at the senior center. I know you come and do the foot clinic and the flu shots and all. You might want to do a program there geared just to speaking to the people, the seniors, about the fact that should they have to be admitted to the hospital, they have an option.
They have an option.
Okay, to have you,
That's a great idea.
okay?
I think that's really, really important, because that's what I'm thinking of, not just me, because, I mean, I'm not quite as old as Jane is yet. I still
Yet. You may not get there either.
What happens with our senior population high percentage.
That'll be
When they don't have the option to ask and know that there are options out there that they can choose Franklin DNA, or not have someone come from Laconia that, you know, their ratio among patient versus caregivers are very high in Laconia. I'd rather that one-on-one myself. Well, I'd really like to go overseas and talk to someone. Without seems like get the word out, because that's Sanford, right? That's Tilton, Belmont comes to the senior center.
We have some Franklin people too. We have Northfield people.
And there's a lot of Tilton people that go to the Franklin.
The Franklin one,
Senior
yeah.
Center.
Trip Center. I couldn't think of the name of it, the Trip Center. Are your prices going to remain the same for Tilton residents in the next year?
Yes.
Okay. Are you going to have the same hours available to them? You're going to provide the same services?
Yes.
You're going to increase or decrease your staff, or is it going to remain the same?
I'd like to increase our staff, our skilled staff, our nurses, another nurse, at least one. And we're always looking for good people. Nurse, a physical therapist.
I noticed from 14-15, the bad debt went down from 37 to 17. Is that because of more people getting insurance now, or having to get insurance?
That's probably part of it, especially for 2016, that's probably going to be low too, because people are required to have insurance.
Yep.
Whereas
Before they're like,
before,
Yeah.
self-pay, I mean,
Yeah.
if you don't have insurance, there's a chance that we're not going to get paid at all. So there was probably a higher chance of things getting written off as uncollectible then. 2016, I mean, people need insurance, so there's less chance. The chances where we write off for bad debt this year that I've been seeing, it's not because we're having people that don't have insurance necessarily. It's situations where we think it's Medicaid, and then we find out after we did a few visits that it was well center, healthy families, and we already did those visits, we're not getting paid for them, we have to write them off.
Yep.
So we're seeing more of that type of thing with changes in insurance, or they're denying it for whatever reason, not so much patients not having insurance. So yeah, that should be going
probably
down as long as the
helped a little.
insurance don't mess with us too much.
so yeah, it's really helped with keeping things a little level
Yeah.
instead of going up, because usually those things, bad debts go up.
If you could just get us your most recent financials.
If you don't mind, if you see any significant differences, maybe put a little explanation so we
From,
don't have
like,
to
year
ask
to
you
year.
again.
Yeah.
Yeah, I can highlight
Yeah.
things for you.
Great.
Any other questions?
No?
You keep up the good work. You do an excellent job. I can't say enough for you.
Thank you.
I had occasion to be the caregiver for a certain person recently in the room.
Bragging about that.
She reciprocated, though.
But let me tell you, I was very, very impressed
Yep.
with the nurses, the RNs, and with the physical therapist. I was very impressed.
It's good to hear.
Thank you.
Thank you.
Thank you very much.
Okay. Make a motion, was it?
Lake Solution didn't show up. Do we need them to come? I just get the financials.
No, we don't need
planning?
Get the financials.
Yeah, get
The
the final.
financials and we'll,
Yeah,
Yeah.
just, if you can call Lake Region, I don't know why they didn't show up. All we need is their financials. We don't need to see them.
we can ask questions and
Yeah.
Yeah.
If we have any questions, we can get in touch with them.
So we saw
I think we're pretty familiar with them anyway, because we work with them. so. Anything else?
just the financial reports.
Anything else? I think you're over here.
I know, well,
And he's so quiet, too.
Taking it all in.
I was that person last year.
Our final employee started on Monday.
Is that with the
So-
highway department?
Yep, so we have our full staff. It's been very
Wow.
difficult. We had pretty much, well, we had
Before
three
winter,
guys,
thank God.
Yeah, trying to carry, without even a supervisor, carrying everything all summer. And they've done a great job. We're hoping to get
Keep
caught
those
up.
three.
And we're getting after the paving companies to get the paving done. It's a last
Nice.
rush.
Before winter.
They better before winter, because they're not gonna have any
I thought
asphalt.
Pat said it was getting done beginning of November anyways, right? She said that.
We're working on the tax rate.
Yeah, what's the update on that?
Well, presently, we're looking at the tax rate. We're trying to figure out, we'll decide tomorrow night. We're looking at our capital reserve and how much to draw out of that. We have about, let's see, got a hotkey to it. So we're looking at how much to use of the fund balance to
Keep the taxes
keep
down.
the taxes down, and that was, if you can probably watch our discussion.
I was just gonna say.
That's what
watch-
we were talking
Watch
about
the
watching
paper.
it.
There's a lot involved in it.
Because I wanted to know how much that recycling change affected that too. Our rate's going up for that, right?
Yeah, that's another thing that we're working on too, because that's been hitting us
It's
hard.
gonna be, it's gonna be a contentious.
Yeah, it's been steadily increasing. We're
I
asking.
knew it was gonna happen.
I know, I did not vote to get rid of
We've
it,
been
so.
asking everybody to please recycle. It's making a difference, and it will hit your taxes, you know, if people
Well-
don't chip in, and don't throw yard waste
Right.
in there, or, you know, your scrap metals, or
I think
things
it's
like that.
apartment buildings aren't gonna give to, you know, because it's not their tax rate being affected. Now they don't have to buy bags. You know, they're not gonna recycle.
So,
So anyway, so it's going up.
yeah, depending on how much,
6.9.
You're voting on final tomorrow, or?
depending, well, we're going to have to decide on that tomorrow.
Okay.
So, we were looking at, if we were to use, let's say, 175,000 from our fund balance, you know, that would be at 6.97, which would be 0.16 per thousand going up.
And that's 100,000 out of the fund?
That would be at 175,000.
175.
Presently,
I have my glasses on.
I don't have the amount. I think we have around 750 in there now. The state asks that we keep, they suggest that we keep a minimum of 5%, so we're well over that.
Okay.
But the hard part is next year, where if we take too much out to keep the tax rate down, next year we could have a bigger increase,
Yeah.
because we have a police department contract that's going through, so we have to plan for that.
And there's a
So-
school contract going
Oh, school contract too.
next year.
Yeah,
Yeah,
And-
smaller jumps is better than a big
fire
one.
building.
Yeah, and that was one of the big things that was a discussion at the selectmen's meeting. Should we try and keep it, you know, completely level? But then, in order to do that, we'd be drawing down our fund balance, which we wouldn't potentially have next year if we get an increase to kind of level it off.
And DRA makes you keep it at a certain level.
I want you to have 5%. And so next year, we could have a spike if we do that. And it's really hard for people to plan for their mortgages, as well as people who escrow their
Right.
mortgages also, and they can get hit with this extra.
I like the
So-
slow steps at a time instead
like
of
the
trying to
slow
be,
steps.
try to be level and then gigantic. Doing it steady is a lot better.
And Tilton's not gonna get hit as hard as
We're
us.
going to go down a little bit next
Oh, we
year
are?
on school.
Okay.
Because of the
Good.
formula, which
Right.
we figured that
Northfield
out
is
2
gonna
years
get-
ago.
Creamed,
I
Yeah.
mean, really,
Why is that?
really.
we got a lot of people.
Yeah, it's the whole valuation and the formula, which I did on this formula committee 2 years ago. That was my first year.
Oh, my gosh.
You were on the formula committee. And that was, and, you know, we worked with Northfield, and, you know, it is what it is, and
Wow.
you get stuck with that. I just discussed a little bit that we're working on the tax rate, and there were a few suggestions. You suggest keeping it level, kind of.
Yeah, not like keeping it the same as last year, and then next year we're gonna get a big jump. I'd rather have
terms of using
jump,
fund
like
balance.
steps. You know what I mean? It'd be easier on people. I think
But the
people don't
selectmen
realize.
usually do that.
Yeah, that's a good, I like that.
What are your thoughts?
I don't like a big jump. You know it's gonna go up, so.
Well, you're building that expensive house, so of course
Whatever
you're-
is cheapest in the long run.
Okay, keep it down, please.
I would want.
I know, I'll be giving revenue
Yeah.
real soon, probably next year, a huge chunk to this town, because we have current use.
There's no real long-run cheapest thing, because things
I
are going
know.
to be
I know, it's
escalating
something that
some.
you could answer,
Hopefully,
but,
everybody's incomes will, but,
I don't know, I'll have to think about that.
Remember, we're lucky because we have extra 20.
Yeah.
I mean, really, we are very, very lucky that we have that.
Oh, we are, yeah.
JJ.
J. Jill, yeah.
But I'm just wondering, what is
Well,
the
140.
projected, sometimes people do a projected, you know, they look at the tax increases over 10 years and project out, you know. Of course, we can't really do that if we're gonna be doing the fire district and
School.
the police, or, I don't know about the police building or not, but I'm just wondering about the long-term, 5 to 10 years, what we're looking at overall. I know you can't really project that, but I just have that in mind, like,
I mean, it could go up, could go down.
well, it's probably not
that's
gonna
the
go
price
down.
per thousand, but, you know, at the same time, our valuations are going to go up. When we get,
Yeah, I
we
mean,
just had
everything-
that, so when's the next
Tied
total
together.
town evaluation is?
It's 19 or 20.
So we're pretty much for the spot valuations, but, so we run with that, so
Yeah. So your valuations go, on properties go up, but.
You could also have a lot of changes at the state level.
Mean that you're-
You could have an income tax, or you could have a sales tax.
Oh, I know, yeah, there's
May have a
so
big
many
effect on
variables.
property tax.
Yeah, I'm just trying to hopefully keep our budget, overall with the town, that's the only thing we could control, and, you know, keep it as thrifty as possible because of all the changes that are gonna be happening.
Well, I'm sure the select
Prudent
board is gonna
spending.
do
Yeah.
that because they're homeowners too.
yeah. I
Well,
mean, you still have to maintain things
Yeah.
and keep everything running. It's
I know.
prudent spending and,
well, we have a lot of pay
Everybody's working.
raises, I think those are the big items, though, too.
health insurance,
Oh, God,
Because of health
insurance still
insurance.
went up, yeah.
We can't.
Retirement.
How much can we really afford?
that's the
Yeah.
retirement, you know, that's a huge,
Three-year contract now that we're negotiating with the police right now, because that expires in July.
and our retirement contributions just went up the amount at the town. We're up to 21?
29.
29.
Yeah,
So-
that's another problem, the way that is, but that's beside the point.
So that's what the selectmen have been working on, and as you can see, it is a little dilemma, you know, how to do it, and
Yeah.
we're working it out.
And one of the other things I wanted to say to Jules, when you talk about restricting the pot, I think one of the things that we need to keep in mind when we give to outside agencies, for instance, visiting nurses or CAP, is that those services keep our welfare budget down, and we have one of the lowest welfare budgets. If you look at other towns around us, take a look. Go
Probably
into
within
San
50
Bertrand.
miles.
Huh?
Probably within 50 miles.
Yeah.
Those.
Go and look at the other towns and see what they I mean, we give nothing to welfare according, to other towns.
She
It's
sends them
rock bottom.
resources, that's why. It's not like teachers, it's not like they're not help.
Right, well,
Right.
not all of
But she
the
has
things
25 years
are
of experience.
Yep.
Plugs into
direct
resources.
services like health services, though. We do
And she's not
give a
afraid to
lot
pick the
that
phone up.
are not. Well, I mean, the band programs, that doesn't have anything.
$2,000?
There's other things. Okay.
Well, I
the-
mean, I...
Take, for instance, the library wage increases, that's $5,000. I mean, I'm not saying not to give it, I'm just saying that's not really correct either. That's not all, it's not all welfare,
Well, look at last time you had $177,000 go to outside agencies. And if you look at, pound for pound, what we get back in the community, $67,000 of that was Pines Community Center, of that
Right.
$177,000. 23 was Franklin B and A. 23, almost 24 was community action.
Yeah,
Which one you get the most bang for the buck out of is,
right. No, I agree, I mean, if I were to choose,
Well, the one that you get the most bang for the buck is the association with the line. There's no question about it. Because they'll come in your home, one home, when they outfit you for macular degeneration, for all kinds of equipment and things so that you can see and lighting and all that, it's clearly a $2,600 package. So you're giving to them $500, and they did what,
3,000 is what they
six
requested.
last year, something
I
like
think they
that.
requested 3,000.
Right.
yeah, I
They
mean,
request 3,000, we've only given them
1,500.
1,500.
oh, yeah, no, I would definitely, if I had to choose, keep those things like the VNA and the, so, health services are very important, but we still have a lot of things that are, possibly luxury.
Now, we put money away to look into having our own teen center. How's that going? The engineering, remember we were looking at the church, and is that going anywhere? We could use that. I would love to have a center in Tilton.
There's no more action on the church. We did have another building come up that was a very good resource for us, but then we were going to have it appraised. But they sold it right out from under us, almost within a week of.
we're real close. It would have been perfect, but
So
Shit.
we're no further ahead of that as far as that's concerned. The church is unrealistic. Cellular contract that they have in
some of the agencies or people that come to us for money also have a lot of money in investments that have provided significant income over the last 2 years because mutual funds and that have gone up. So their ability to raise money on their own without us, in some cases, has been improving.
Well, I
You
think
know,
the
so when we
investments
look at
went
our-
down. So far, the ones we've looked at, all their investments have gone down, and that's, because of the market.
Well, we
Their-
have
their
one that
income
has-
from in-
We have one that really has a big portfolio. And last year was the
And lots
first
of
year we
grants.
ever gave, first year we gave to them.
Oh, okay.
That's
Yeah.
Genesis.
So-
Yeah.
Some people just
My
have
daughter works for
assets
Mountain
of-
Ridge,
of,
so.
just funds and bank accounts or real property. But there are ones that have actually invested their money and have realized a bigger return, so that might be something to look at.
Yeah.
It's not,
I mean, we give the dog catcher, what? That used to fall under here. I think that was taken away, wasn't it?
it's still in here.
It's a contract we don't,
It's still in our budget?
no, but it's not in our, it's not the agency's budget anymore. Right.
not an outside, it's considered an outside agency, but we don't have them in there because it's contractual with
Yeah.
us. Because by law, we require to
Yeah.
have it.
So that came out.
You can't have it. It's, I forget what it is, I think it's 3,600.
But that's always worked out.
5,000.
It's
I never
still-
see a dog catcher.
No.
Do you see any
I
stray
don't
dogs
see any
running
dogs.
around?
Yeah, no.
It's the
Really?
kennel where we take
Stealthy.
them.
Oh, okay.
5,500.
That's gone, that request is gone, but we don't do that this year.
No, because it's a contractual thing every year that we
But
have
it
to.
would be in our,
It used to be in ours.
we'll still look at it in the budget. But,
But it's not something we grant, we used to sign off on it, remember?
yeah.
All right, is there anything
Well,
else?
the other one also too was.
Park Cemetery?
Yeah. Yeah. But, I mean, it is what it is. We have very people.
Yeah.
It hasn't gone up, and it hasn't gone up any.
Do we get the budget from the Parks Department yet?
Those are the ones we have to look at, I think.
Yeah, because, I mean,
We have to look at all of them.
Sewer, park.
Yeah. All of them should be
we've
looked
got,
at.
we've got
I meant look at the closely.
full employment
All of them should.
Yeah, we
at
need
the
to tighten
Public
up
Works Department.
some buttons.
We're paying out to have our lawns mowed by a landscaper, so,
Oh.
We have a full complement of employees now.
yeah.
at the
Oh, okay.
Garage as of this week.
Yeah.
And we
The last
had not
employee
had.
Came on this week.
And we've
Yeah.
got 2 zero-turn mowers, and- but,
Well,
We don't need mowing anymore now.
We have one.
yeah, the town owns 2 zero-turn mowers, but we pay somebody else to mow,
Oh, okay.
a contractor.
All right, anybody want to
I
make a
just like throw
motion?
that in.
Make a motion.
Adjourn.
Second.
All in favor? Aye. Opposed?
He's out of here too.
Really?
Be back tomorrow.
Oh, yeah, you will be. We only had one this week.